Hello and welcome everybody. I'm very pleased to say today we're going to talk about I've already started off by making a mistake, congenital heart disease with two leading experts, and we've never spoken about heart disease before, and I do think this is really important, because it's lots of people have heart conditions, whether they develop them later or they are born with heart conditions. But today we're looking at specifically in terms of mental health. And a lot of what we're going to cover, that Tracy and Lisa are going to cover, is very much around how this can also work with other chronic health conditions. I think there's a lot of real relevant lessons to be learned and to understand. Likewise, I think it's also really interesting if you know somebody who does have heart conditions or even chronic health conditions, some of the things that you will understand that they will have gone through, but maybe not necessarily told you. And I think it's very much an awareness session as well. So without much ado, and this is we've got they've created some really nice slides with some great pictures, and there's one coming up with a dog, which I absolutely love. But anyway, you'll see that in a minute. So can I ask both of you to please introduce yourselves, and we can kick off.
Sure. So I'm Tracy Livecchi, and I'm a clinical social worker based in the US. I live and work in Connecticut, and I have a private practice as a psychotherapist. And I work with a lot of people with chronic health issues and focus specifically, most of the people that I see do have something cardiac related. In addition to that, I work as a consultant for the Adult Congenital Heart Association's peer mentorship program, helping to supervise their program, where we match people who have been through certain surgeries with people who are newly diagnosed or need some extra support. And I'm also as you mentioned earlier, I'm also somebody who has been born with a congenital heart condition. I've been in and out of the hospital. I really have lost track of how many times I've been in the hospital for surgeries and procedures. So I also come with that lived experience as well as that professional experience.
Thank you. And Lisa. Oh, you're on mute, Lisa.
Sorry. Hi, I'm Liza. I'm a counselling psychologist who lives in Scotland in the UK, obviously. And so I currently have an independent practice, but previously I worked for over 10 years in the NHS, in NHS 5, in adult mental health team, working with a range of people with different mental health difficulties. I currently also have a part-time post at Glasgow Caledonian University, where I contribute to the doctoral training programme, so our counselling psychologists coming through. I've also been involved in psychology research for over 20 years since completing a PhD at the University of Glasgow, and I'm particularly interested in something I've termed psychologically informed medicine, which really looks to improve outcomes for people with long-term health conditions, to mitigate risk factors and to promote protective factors to try to improve outcomes in terms of well-being, but also to try and reduce kind of medical trauma. So I also work voluntarily for the Somerville Foundation. So the Somerville Heart Foundation is the UK's leading charity that supports adults with congenital cardiac conditions. And I was fitted myself with my first pacemaker at 11 days old back in 1978 at York Hill Hospital in Glasgow. So that was a world first at the time. And I've depended on pioneering treatment ever since then. So I'm currently on my 11th pacemaker, I think. So yeah, I've been working with Tracy over the last 4 years probably, writing our book together, because we met through our joint advocacy efforts. So across the Atlantic, we've still not met in person. And through those advocacy efforts, we were kind of talking about our interest in mental health and just the lack of support, psychological and emotional support for this growing adult population. So we're both first generation kind of congenital heart survivors. And we decided to write the book that we have been looking for, but we've been unable to find.
And I think that's what makes this particularly interesting, is because not only are you just experts, but the fact that you completely understand what people are going through. And the fact is that you also understand it, everybody's experience is different. There is no sort of definite pathway that people go down in their emotions. Nothing's right, nothing's wrong. It's just how you feel. And I think that's what makes this particularly interesting, the personal side of it. So
Yeah.
going on to our first slide with the dog, which is what I mentioned.
I know, it's adorable. I love it. So just to let people know, today we will be covering medical trauma, which can be a really sensitive topic. And, for a lot of us, our childhood experiences with our health conditions can sometimes follow us into adulthood. And that can be sometimes really hard to remember. So we just want to really kind of prepare people and have you be aware of your responses to this talk. And if you're having any feelings that are uncomfortable, making sure that you take care of yourself and that you connect with somebody that can help support you afterwards.
Thank you.
You're welcome.
Okay.
So just a little bit about congenital heart disease. So there are 12 million people, about 12 million people worldwide that live with a heart condition from birth. There is no known cure. Once you're born with a heart defect, you are going to always have one, and you're going to always require specialized care. That is the recommendation. And sadly, or astonishingly enough, the Adult Congenital Heart Association estimated that only 10% of us are in the right kind of care. So increasing awareness about CHD can actually save lives because this is a growing population. It's the most common congenital birth defect in the world. Nearly about 1% of all babies are born with a CHD. So clearly, this population is growing, and it still remains the number one cause of birth-related deaths. So again, this is after all of the success that we've had since the 1940s. There's been a lot of technological advances with cardiac care, but it still remains the number one, congenital defect from birth. Next, please. So before I get into talking about statistics related to mental health and CHD, I think it's important to just acknowledge that a lot of the responses that people have to being born with a health condition or having a lifelong chronic condition can be very normal. And they can be very normal responses to a very unusual life circumstance. It's not usual to be in the hospital for weeks on end as a child. And it's not usual as an adult to have to be in and out of the hospital very unexpectedly for some invasive and sometimes painful procedures. So, sometimes, you might be feeling some signs of grief, sadness, feelings of loss around possibly not being able to keep up with your peers, maybe not being able to safely carry a pregnancy, or possibly responding to, as you age, some deteriorating health. All of that is very normal, and it doesn't necessarily mean that you have a diagnosis or a disorder. However, a lot of studies have shown that in terms of CHD, there is a 50% lifetime prevalence of folks being diagnosed with depression, anxiety, or post-traumatic stress. And that is more than double the general population. So that is significant. I think it's also significant to know that most of those individuals aren't in any kind of mental health care. They're not in any kind of treatment, 69%. And that's important because we need to be treated for these different issues, because if you have depression, studies show that you're going to be much more likely to have another incidence of any kind of cardiac incidents. And it can also really affect your physical health in a lot of different ways. Also, people with depression and post-traumatic stress have been found to not always follow their doctor's orders. Sometimes, I hear from people I work with that, oh, I forgot to take my medication for a few days. I couldn't get out of bed. Why bother? I missed my doctor's appointment. I forgot. So you really want to get the treatment if you are having a lot of these more intense responses to your health situation. We want to make sure that you're not suffering silently and worrying alone. So this is a really, I think, great graphic that that we found and was put into a scientific statement with the American Heart Association recently. And it shows kind of the life stages of somebody who is born with a serious medical condition, really starting in, in utero and moving all the way through aging. There are, again, everybody is different. Not everybody is going to experience the same challenges, but for folks with a congenital heart condition, there has been shown that sometimes there are some neurocognitive deficits or learning differences that folks have gone through. There are certainly family stressors that a lot of families go through. Having a child with special needs can really put on some financial strain onto the family. Siblings certainly feel the effects. There are caregiver issues sometimes. As a teenager, I remember feeling very different from my peers and, having some body image issues, just in terms of a lot of scarring because of my surgeries that I had to go through. Again, not everybody is going to have the same challenges, but these are just some of them. A lot of medical interventions can, again, follow us through our life, going in and out of the hospital repeatedly. There is something, though, that we have found and studies have shown that folks with CHDs do tend to really have the sense of resilience, which is great. And they find ways to cope. And, a lot of studies have actually shown that, believe it or not, despite all of these challenges, their quality of life is actually quite good. So that's a positive to take from this. And then moving on through life, as we age, I know, I'm now 55 years old and, dealing with some, aging issues and how my CHD affects my body as I age. And there can be some feelings around that. And, a lot of people notice some deterioration of health as well. So again, everyone is different, but just a reminder that even with CHD or any kind of chronic health issues, we're not only dealing with normal life stressors, but we also have this layer of challenges to contend with. I think Lisa's going to take over here.
Thanks, Tracy. I'll remember to unmute this time. So yeah, just kind of building on what Tracy was talking about in terms of if you're living with a long-term health problem, the additional barriers and stressors that you may face. And one of the main things can be exposure to medical trauma that is potentially different to our peers. And medical interventions themselves, they can be quite painful and frightening, and often, particularly during childhood, but as adults as well, we might have to endure them in the absence of a loved one. I know that when I was young, most of the surgeries that I had, I was taken away from my mum, you can see from that quote there, and to theatre. So it was kind of like a team of people in green scrubs kind of took me away from my mum through the double doors to theatre, and I had to, wait a wee while in the kind of the pre-theatre room, but then also coming round from quite difficult surgery in her absence as well, because she wasn't allowed there either. So that can really have its impact. We also know that clinical holding, so that's holding children down for procedures, is common. So Lucy Bray at Edge Hill University is a nurse, and she's a professor of children's literacy, and she's done some fantastic work where she's looked into how often children are held for procedures, and it's really quite high, even although the recommendations are it should be a last resort. So this is currently still going on, and has led to some really important work called the I Support. which are right-based standards that I've been involved in with Lucy to develop to give children rights during medical procedures. So yeah, cardiac medical events or any medical events can really be quite abrupt. They can mean that you're kind of blue lighted to the hospital. They can be uncomfortable physical kind of exams, uncertainty, living with symptoms, trying to figure out whether or not, you know, if you have a kind of heart palpitation, was that anxiety or was that my kind of heart? Is that problematic? Do I need to follow it up? And one of the things that's really unusual for us is that we are often exposed to the same traumatic events time after time again. So we're having to go back to the place where that's happened. And often from infancy right throughout our lives. So you're kind of going there with all these kind of layers of memories. So we just feel that it's really important that healthcare professionals recognise that hospitals and medical teams are probably a really significant part of our life. We probably get quite mixed feelings. You know, that's the place where we've been made better, that's the place where people have looked after us, but it's also potentially a place where we have been in a lot of pain or we have had quite traumatic experiences. So we do know that following a traumatic event, then it's normal for us to go into fight, flight or freeze mode. So that's absolutely normal. And that's our body going into defense mode. So if our bodies perceive that we're under threat, then we go into fight, flight or freeze mode. So a normative response to any traumatic event is that after that traumatic event, because of the way our minds and bodies respond to it, then we try to make sense of it afterwards. And usually that's through nightmares and flashbacks. And that's because the part of our brains that usually process memories are a bit compromised, because basically all the resources go to defense and the fear center becomes activated. And when that's activated, it means that other parts of our brain kind of shut down a bit. So the kind of frontal parts of our brain where we usually think things through sensibly, we don't really need them because our bodies are preparing to respond very quickly. But that means in the aftermath of trauma, it's very normal for people to report they still feel hypervigilant, they still feel anxious and angry. They often report feeling a bit sad, even guilty and numb. And because when we go through traumatic events, our bodies release stress hormones such as cortisol and adrenaline. And those kind of prepare our body for defense. Our heart rate goes up, our muscles tense, our breathing becomes rapid, and that's preparing you for that fight or flight. But generally speaking, afterwards, we can just be a bit exhausted. All that adrenaline has been going around our body. So we do need a bit of a recovery period. People often commonly report that after traumatic events, they might feel a bit differently about the world. So they might feel like it's not as safe as they once did. They might feel like they've lost a bit of trust in others or even kind of blaming themselves. And they can still feel quite kind of hyper active in terms of their nervous system, which can affect sleep, can mean that you're quite jumpy. But usually all of these things are a normative reaction to a traumatic event. And usually in the days and weeks after that, our bodies will kind of start to feel safe again. We'll start to feel like we once did, and we'll start to kind of function normally. However, for some people, and this is a minority of people, most people, you know, when they face a traumatic event, they do kind of go back to functioning as they once did. However, for a smaller proportion of people, symptoms actually get worse and they don't recover. So if you feel like you still have some symptoms after a month, or if to deal with those symptoms, you've taken up kind of unhealthy or unhelpful kind of coping strategies, and that can be alcohol or drug abuse, social withdrawal, feeling you're having angry outbursts or suicidal, then it might be time to kind of ask your GP to refer you on to treatment. One of the more serious mental health problems that can develop following exposure to a traumatic incident is something called post-traumatic stress disorder. So this is in the Diagnostic and Statistical Manual, and in that manual, the symptoms of that are continued hypervigilance. So you still feel that sense of hypervigilance. You don't feel safe again. Your sleep is still being disturbed. You're still feeling quite low, emotionally reactive, particularly in response to triggers of the trauma. So things that remind you of the trauma. And one of the things about trauma is it's very sensory in nature. So often it's sights, sounds, smells. So people describe, you know, they kind of smell something. For me, it was always kind of things like the smell of toast, because that was the first thing they gave me after surgery. Or kind of smells that smell a bit like theatre. So if you're continuing to have these symptoms, then that can be indicative of PTSD. This is a highly treatable condition, trauma-informed kind of CBT, or something called EMDR, which is eye movement desensitization therapy, have been found to be highly effective in treating PTSD and are in the current NICE guidelines. So that's something that you can talk to your care team or your GP about.
I think just very quickly, what's nice is it's really good to, because, you know, sometimes you come out of something and you don't know how you should be reacting or what's normal or what isn't.
Yeah.
And I think that's quite a nice thing to say, well, these are all the things that could possibly happen. Generally, you will be fine. But if after a month, you know, and that you have a guideline of a certain time period, if after a month it's still not quite right, go and seek help.
Absolutely. I mean, in terms of, like, as a psychologist, you would have that kind of watching and waiting period of a month, because most people do kind of go back to normal functioning and feeling safe again. Absolutely. And, you know, we have evolved to deal with trauma. So, you know, for the majority of people, they will make that recovery. But on this next slide, really, is something that I was kind of interested in. Well, why do some people recover and have a normative response, and why do some people want to develop PTSD? And part of the answer is here. So we know from the psychology evidence base that there are certain risk factors that can increase your risk of going on to develop a more serious mental health difficulty, and there are certain protective factors. So if there increase kind of risk factors and decrease protective factors, then you're kind of upping your risk of developing something like PTSD. So in terms of the risk factors, they are things like if you have a background of childhood adversity, so if you've had more adverse childhood experiences, if you've had previous mental health difficulties or physical health difficulties, if you've got a lack of social support around you during the traumatic incident or in the aftermath. So if you think about that in terms of hospitals, if mum wasn't with you, or if a loved one wasn't able to stay with you, or even if the care team weren't perhaps particularly psychologically minded and able to offer you compassion. If you thought that you were going to die, if you perceived life threat, then you're more likely to develop PTSD. And so that's, two people can be exposed to exactly the same situation, but what it means to them can change the outcome. So somebody might kind of think, oh, I was going to die, and they're more likely to develop PTSD, whereas somebody else might not have had that thought. So again, it's that kind of meaning. Life stressors, so it also depends on what's going on in your life otherwise. So if you've got relationship difficulties, financial problems, housing problems, then you're more likely, you're more vulnerable. And whereas, you know, if things are quite secure at home, if you've got happy relationships, lots of kind of, you're financially all right, then you're less likely to. And often when I see people in therapy, they'll say, why now? I was exposed to far worse previously, but I didn't develop this. And this kind of helps to explain that, because it depends what else is going on. And also trauma is cumulative, so it can be repeated. And it can be secondhand as well. So sometimes we might directly kind of be exposed to something, but then we might hear something in the news, so it may be indirect, and that is kind of re-triggering. So those are the kind of risk factors. And Tracy and I kind of talk about this quite a lot in our book in terms of, well, there are things about having a congenital heart or a health condition that we can't change. But if we know about what are the risk and protective factors, how do we, these are the things that we can change and mitigate. So with the protective factors, so the things that can help to prevent the development of more serious mental health difficulties, these include things like good social support during the incident and afterwards, having a sense of control, so having some kind of sense of control over what's happening to you, so not having that sense of powerlessness. And I've done some work in terms of my research and looking at things like the impact of wearing the hospital gown, because the backless hospital gown really kind of adds to a sense of being powerless and vulnerable. So things like that could very much be improved. Help seeking, so if people seek help when they need it. Meaning seeking, so if people kind of build kind of a sense of meaning out of their experiences, so that can be things like offering peer support to others, or often you see people raising money, you know, for hospitals, and kind of finding some meaning. Resilience and coping skills. So resilience isn't something that's fixed. Resilience can very much be built on, it can be nourished, it can be developed, as can coping skills. And again, that's something that Tracy and I kind of focus on in the book, how to develop them. Having an opportunity to process those feelings, so emotional release, and also having adequate psychological support during and after as well. So I'm going to hand back to Tracy, and she's going to tell us a little bit more about our book specifically.
Yeah, so the interesting thing is that Liza and I are living so far away from one another, but we connected in terms of our advocacy efforts and realized that we were both feeling this enormous gap in psychological support and care. And we really came together and said, we've got to do something about this. So this book, Healing Hearts and Minds, is the first book in the world that we know of that focuses on the emotional and psychosocial and practical challenges in living with a CHD. We try to take a real holistic approach, and our goal is really to promote connection, help people feel more hopeful, and again, to normalize responses that, that come from a cumulative challenge and barriers that we can face having a chronic illness from birth. We really try to recognize that everybody's different. We have about 40 different testimonials throughout the book from different individuals who have a CHD, from family members, even from doctors. So we really wanted to try to get a wide range of perspectives. We have people from South Africa, Malaysia. We have folks from Australia and the UK, the US, Canada. So that's one of the things I'm most proud of. The book also, as Liza had mentioned, we provide a lot of evidence-based information, tools and tips for getting through some of the challenges and some of the more uncomfortable feelings, not only for people who are living with their CHD, but also for their families and for healthcare professionals. We have a whole chapter for loved ones and healthcare professionals. And we're really hoping to help people to become, more of a patient expert and feeling more empowered to have some control over the care that they receive.
And it's interesting, isn't it, that, particularly it's highlighted because two of you coming from, still a Western culture, but different cultures nonetheless, different health systems, that you're still feeling the same. And the fact that you found that with everybody, that everybody goes through something similar or equivalent. And I know that having read some of the stuff that I've seen from you, is that some of it is, you think, well, that's just so obvious, but it's obvious when it's being pointed out to you, some of the issues, isn't it? And I'm sure that's probably what a lot of healthcare professionals think, well, yes, that's obvious, isn't it? But nobody's actually written it down and made it something that one can totally understand and do something about.
Absolutely, absolutely. So, I think that, because of the nature of CHD, a lot of people, were so focused on survival that the psychosocial challenges weren't really considered. So this, we've already been getting some messages from people who have read the book saying, wow, I really feel validated. I feel like, you really get it. So that's been extremely meaningful for me. And I know for Liza as well. Next slide, please. Yeah, so I remember being in my 20s and early 30s and just searching in libraries and bookstores to try to find any kind of resource to validate how I was feeling and kind of put together my experience. And the only books that I could find on heart disease were really geared towards older men in need of dietary and lifestyle changes, people with coronary heart disease, which is very different from congenital heart disease. So as a young woman, that was just not helpful. So, again, this book is the book that Liza and I have always needed, but could never find. This is just, an example of our table of contents and what's in the book. We give a brief history of the technological advances in the congenital heart field, the impact. We talk a lot about Again, what Liza was saying, the body's alarm system, anxiety, low mood, anger, which are some responses that people frequently have to chronic health conditions. Again, evidence-based strategies for coping. We have a chapter on maintaining important relationships, self-compassion. We talk a lot about the importance of being compassionate with yourself, how to deal with issues around dating, issues around maybe becoming more independent as teenagers and young adults, separating from your family of origin. And we talk about also having children. If you decide to have children, how to talk to your children about your illness, and how to explain to them if you need to go back in for a procedure or surgery. And then we have the chapter for loved ones, advice for loved ones and how to best support us, also physicians and mental health professionals as well. And we talk about the gifts of CHD, which are often hidden, but again, the resilience that a lot of people report, the good quality of life that many report, and we list many, many others in the book. At the end of the book, we also list resources and organizations that you can connect with if you want to connect with others.
Excellent.
So storytelling can be really, really powerful. It's definitely a personal choice. I know I had to think a lot about it before going in and telling my story to the world, but it can be powerful. And I think that if people aren't ready to really share it with others, journaling can be exceptionally helpful. Just in terms of kind of validating your experience, putting things in order, helping to create meaning and purpose. So I do encourage you to consider that. Again, not just folks with CHD, but also if you have any kind of chronic health issue, I think it can be really helpful. So coping strategies, really important. I know that when we are in any kind of crisis, it's very common to fall back on old habits. And sometimes those habits are helpful and sometimes they're not. I think, what I recommend is that people really evaluate what your coping strategies are and make sure that they're not harmful or unhelpful. So some of the more harmful ones that I hear about with the clients that I work with are substance abuse, using substances to cope with stress, either alcohol or drugs, prescription drugs as well. You got to be careful for really trying to look at your support system, making sure that it's healthy, making sure that you trust the people in your life. That's one of the most protective factors ever. A lot of studies show that if you're isolated and lonely, that can be just as dangerous as smoking or obesity, believe it or not. Emotional release or talking about it, getting your feelings off your chest can also be really, really helpful. Physical activity, super helpful. Of course, you want to check with your physicians to make sure that what you're doing is okay for your heart and for your overall health. Finding what brings you joy, bringing it into your schedule, making sure that you build it in every day. Journaling, writing about it, thinking about the way you talk to yourself. We all do talk to ourselves. It's very normal, but making sure that the way you do it is kind and that you would never talk or treat yourself in ways that you wouldn't treat a friend or a loved one. Again, getting a good night's sleep. If you're sleep deprived, that is only going to feed your anxiety. It's only going to feed your low mood. Getting a massage. I know I love to get a massage. I love to get my nails done. Finding humor, hanging out with people that make you laugh. Maybe buy a silly mug that you can drink your coffee or tea out of in the morning. And again, surrounding yourself with things that bring you joy. So, again, building on coping strategies. A lot of times when people are in crisis or, feeling overwhelmed, I like to remind them to really try to just take things one day at a time, sometimes even 1 minute at a time, making sure that you're not jumping ahead to the worst possible scenario. That is called, you're catastrophizing. We don't want anyone to do that. Distancing yourself from any kind of negative possibilities until you're, ready to really face them in a way that is reality based. Really trying to search for personal meaning. A lot of people that I work with tell me that their health challenges has helped them to deepen parts of their life. They found more meaningful relationships, and they may have even reorganized or reprioritized some of the things in their life, which actually can be super, super important in terms of having a good quality of life. And again, knowing if you need professional assistance, making sure that you are able to reach out and know that it takes courage and strength to do that. I'll pass it over now to Liza.
Thanks, Tracy. Yeah, so I guess this is just a kind of taster of some of the stuff that's in the book. So we also, we've got a whole chapter on this, but developing patient expertise is really important. So yeah, partnering with your medical team, understanding that when you're in that patient role, it's quite common to feel vulnerable and dependent and frightened, and that's okay. But that means that you might want to do a bit of preparation beforehand, write questions down, and maybe take a loved one with you, and kind of plan for those events as well. Sorry, just moving the slide on. So as I said, we do have a whole chapter in the book again about kind of coping with the kind of medical side of things, but just some very basic kind of ideas from that are if you do know that you're going into the hospital, kind of packing physical kind of tools, so making sure you're taking the stuff in that you might need, whether that's kind of clean pajamas, a good book to read, kind of maybe some lotions or creams and shower gels that are comforting. So just all of the things that might kind of help you. Things like maybe photographs of loved ones, of happier times. Advocate for your needs. So, and if you feel that you're not heard, then you can ask somebody else. You have a right to know what's happening with you. And again, that's something we do cover patient rights in the book as well, which can be quite good to know. So I won't read through all of these. I'm sure you can kind of read them yourself, but just a kind of list of things that can help to kind of cope with those hospital experiences, particularly if they do bring back difficult historical memories, and being compassionate with yourself about that as well. So recognizing that within yourself, that it's maybe harder for you to go to the hospital if you've got previous experience of being there and difficult things have happened as well. So as Tracy had mentioned, we do have a whole chapter on our relationships, and what we see is we begin that with our relationship with ourselves, because the most important relationship we do have is clearly with ourselves, and it can be really challenging to keep that positive when you have a physical health problem, because often we end up in this battle with our body, and I know that I certainly have over the years, and then kind of driving yourself too hard, or not knowing how hard you can push yourself, and being quite self-critical. So it's really important to develop self-compassion, to learn how to assert yourself, to look after yourself, to not compare apples with oranges. So often we're kind of comparing ourselves to our peers, and how have they managed that? Why are they not struggling? When we're not acknowledging the additional barriers and stressors that we face on a daily basis often. Connecting maybe with others who have similar conditions, so that we're able to kind of put that in perspective and get that peer support.
And it's not a competition, is it?
It's not a competition. And I think, yeah, even two people with the same condition, and we talk about this in the book, can have completely different experiences, because they can have different complications. They can have had interventions at a different kind of developmental stage. Obviously there's other stressors going, they may be in a different financial position, or so there's so many things. So yeah, it's not a competition, but I guess more than ever with social media, there's this kind of social comparison, and it's quite hard not to get kind of drawn into that. And I think if because a lot of there's a lack of awareness about the additional barriers that we face, then we don't recognise them ourselves. So we're kind of thinking, why am I behind in this? Why am I always kind of, because we're not even recognising ourselves. Well, actually, it's because I'm kind of battling things that my peers aren't. And as Tracy had mentioned previously, social support is one of the most protective factors for mental health. So this is something, again, that we really focus on. How do you develop a social network that works for you? Where you nourish all of those positive relationships. You've got people who are supporting you practically, emotionally. You've got people, your go-to people you can have fun with, but also setting boundaries in perhaps more problematic relationships. If people are maybe saying things that aren't helpful or kind of contributing to stress, how do you kind of put limits on that as well?
And all of these things completely apply to any form of trauma, surgery, chronic condition, don't they? I mean, it's all really practical stuff. And, lots of this stuff, especially if one's, is quite an expert patient, this, but it's a good idea to reread it again, to remind yourself.
Yes.
Again.
That's what we wanted to do, just to put it all together in one place, I guess, so that people can kind of have and refer back to. Absolutely. So I'll let Tracy speak to this, but one of, as part of social support is that kind of peer support. So since Tracy has been involved in a peer mentorship program, I'll let her tell us a little bit more about the importance.
Sure, thank you. Yeah, so peer support can be really powerful. I am the mental health consultant at the Adult Congenital Heart Association in the US, and we have a peer mentorship program where we connect folks who have been through certain procedures and surgeries or have certain diagnoses with other people that are going through it. And that has been a wonderful program. In the UK, one of the ways that I'm hearing that people get a lot of connection and support with peers is through social media. Facebook, I know, has a number of different groups based on gender or based on diagnosis. Depending on whatever chronic health condition you might have, you may be able to find something online through Instagram or Facebook. Also, maybe speaking with your specialists about, hey, can you informally connect me with another patient who has something similar to what I have? And that can also be done sometimes. Maybe there's a support group also in your care team center. One thing I do want to say about peer support, though, is while it can be powerful, it can also be sometimes very overwhelming. I know for me, I think I was about 30 years old when I finally first met somebody with my diagnosis, and it was actually very, very scary because he was not doing as well as I was. He was actually quite sick. And as a young woman, that was really scary for me, and it got me thinking, oh my gosh, is this going to happen to me? So I would just really warn everybody that if you're going to try to connect with a peer, just remember that everybody is different. I know Liza said that, I said that, but I can't stress that enough. You can be the same age, have the exact same diagnosis and medical history, but appear very differently in terms of how you're doing prognosis-wise.
And if it's not working for you, don't be frightened to pull away from it as well.
Absolutely. Pull away if you need to. And the other thing I've noticed on social media, sometimes I'll read like medical advice from different people, and you always want to check clearly with your own physician before following any kind of advice from anyone that you connect with online.
Absolutely. Okay. And yeah, I mean, in terms of social support, one of the most protective factors for us, even during medical procedures, is having that soothing presence. So we know that from the research evidence base, that the soothing presence of a loved one can really mitigate the impact of adversity and particularly medical experiences. So for example, there are studies that have shown that preterm infants are more likely to gain weight and survive if they can hear their mum and if mum is able to touch them. And that goes across the lifespan. There have been some studies that have shown that patients are more likely to survive if the doctor makes eye contact and shakes their hand. So it really is important, that kind of compassion, and that we're able to access compassion when we're feeling vulnerable. And part of that is also consistency of care, because we can only develop a relationship with our care team if we're kind of seeing them consistently. And that can be a problem for us as adults, because we potentially, you know, have particularly in the UK, had the same care team as children, and then have had a less consistent approach as adults. So yeah, I mean, kind of just to kind of round things up, we also covered this quite a bit, and we've got a good few chapters on coping with kind of difficult thoughts and feelings, and we cover that in a lot of depth. But just to kind of say here, you know, just check in with how you're feeling. Please do try to validate and acknowledge your own feelings, and find a safe space to talk about difficult stuff. As Tracy had mentioned before, sometimes that can be about kind of journaling. For some people, it's more helpful to do something artistic or creative. That could be, you know, playing music, drawing, writing, or it might be sport, exercise if that's allowed. Allowing yourself to have a good cry, just acknowledging those feelings. There's a lot of messaging, I think, from when, if you have a medical condition from childhood, to be stoic, to be brave, to be this heart warrior. And while all of that can be true, of course it can, that shouldn't mean that you can't acknowledge the vulnerability and the difficult aspects. And sometimes part of being brave is allowing yourself to be vulnerable and acknowledging those difficult feelings. And I'd mentioned earlier that resilience isn't something that we have or we don't have. It's something we can grow. It's something that we can nourish. And again, I'll not read through all of these. You can always kind of pause this and have a look at the different kind of ways in which we can grow resilience. But yeah, there's lots of different things we can do to develop those resilience skills, and also to yeah, I think. Yeah, so this is kind of part of what we call post-traumatic growth. So often people who've had very difficult experiences, and this isn't exclusive from trauma, but often people who've difficult experiences also positively adapt. So they do become more resilient, they do become more determined, they do develop more meaningful relationships. So it's keeping that in mind as well, but recognizing that we can develop that. And that's not exclusive to the trauma, like I said. You know, you can have both be very resilient, but also part of resilience sometimes is recognizing difficult feelings and recognizing when you're struggling and seeking help for that as well. Personal meaning is very important, and like we mentioned right at the start, that can be one of the protective factors in terms of exposure to trauma. So if you feel like, you know, your life has purpose and meaning, very much focusing on what you can do, then that can really kind of help to cope with a long-term health condition. And just always remember that your illness does not define you. It's not who you are. You know, I happen to have been born with a heart condition. It's not who I am as a person. So, you know, kind of making sure that you're remembering that as well. The final chapter of our book does look at how loved ones and healthcare providers can help to support us. So this is something I've termed psychologically informed medicine in particular. And I kind of hinted at this at the start. So I guess there is some recommendations there for healthcare professionals in particular. And it's kind of relating back to what I was talking about in terms of risk factors and protective factors, and why some people develop more serious mental health problems and some people don't. And I think there's a lot that could be done in terms of the healthcare experience to help to mitigate that trauma so people are less likely to develop mental health problems. Tracy mentioned at the start that 50% of people with CHD as adults develop anxiety, depression, or PTSD. I don't think we should accept that as fact. I think that's something we can work to improve, and improving and making kind of the healthcare experience more psychologically informed in itself would help to go a long way with that as well. So it's not just what we do as individuals, it's also what's done within the healthcare system.
And I'm sure that, you know, your book has definitely put, you know, a long way towards helping it by raising awareness, for sure, to so many different areas of people.
Yeah, we absolutely hope that. We hope the book within itself will be an advocate for us, and in addition to kind of providing support on a one-to-one level, we do hope that it will also have a kind of wider impact, and kind of help to contribute towards a sort of cultural shift, both for people, for people with CHD, but also people living with long-term health conditions, in terms of taking a more psychologically informed approach to care. So yeah, just to finish, some good news is that many individuals are thriving with congenital heart conditions. We've been found to be very resilient. As I said, post-traumatic growth has been associated with those kind of childhood medical adversities. So, there is good news. Of course, this is a success story of modern medicine as well. Outcomes have improved vastly over the last 50, 60 years. And, what we want to see is that along with that we move from a kind of survival focused approach to a more holistic approach to care and to living well with a lifelong health condition.
Brilliant.
So, yeah, that's us. There's our kind of details if you want to check out either of us. We've got our own websites, and we're also quite active on social media.
So we've got articles on our website. We've got both of your expert profiles, Understand It. And currently, while we're recording this, we do have an offer on your book, which you can go and find it, as Tracy has reliably informed me, all good bookshops, or whatever they always say at the end of these things. I just think this has just been brilliant, and I really help for people who, who like myself, who didn't understand about it before. You hear the word, but you don't really, if it hasn't touched you personally, it's something that you don't really know about and don't understand. It's not just, oh, well, I had it, somebody had it as a child, they're better now, and that's it. And clearly that's not it. It's a lifelong condition, as so many of these congenital issues are, or even, chronic conditions that are with you for life, and how you manage it, and how something can completely throw you off course, and then you go down that path again, looking at how to manage things.
Yeah.
So I'd like to say, I don't know if there's anything you want to round up with saying, anything other than I would just say thank you so much. And the fact for both of you, this is such a personal journey, really, really does mean something.
Well, thank you for inviting us. It's been a pleasure, and anything we can do to increase awareness around this issue, I think is super important. So I appreciate it very much.
Absolutely.
Yes, just thank you so much for your interest in our book and in our work, and providing this platform to help us spread the word. Yeah.
So thank you everyone for listening, and please go and check the book up, and if you're listening to this relatively soon when we release a recording, go and enter for your chance to win one of the books, which would be great. Thank you.
Thank you.
Thank you.